Hi, everyone, and welcome back to BYF episode 12. My name is Anya, and today we're interviewing Dr. Caroline Okorie, a Stanford Medicine Clinical Associate Professor in Pulmonary Medicine and Sleep Medicine, about why sleep is the most underrated mental health tool. So let's just get right into it. What inspired you to be interested in pursuing pediatric sleep medicine?
Well, thank you for that question and thank you for having me. So I knew I wanted to be a doctor for a long time, but I didn't really know everything about what being a doctor meant. So I thought it was just really about surgery and trauma, and then I learned more about pediatrics and development and psychiatry, mental health, and all these great things you learn in medical school. And so I realized, like, oh, there's a lot more to health than just putting, broken bones back together. That's important too, but I was really interested in other things. So my journey is I did a residency in pediatrics. And then after that, I did a fellowship in pediatric pulmonology. So I learned more about kids breathing and it was through that I actually learned more about sleep medicine. And then I realized how, oh my gosh, so I can help kids breathe while they're, in the acute and long term, but I can also really change their life if I can help them sleep better. And so it was really kind of just being open to new experiences and new mentors that I learned about pediatric sleep medicine. And then I just kind of fell in love with it. So I feel like I was very lucky that I got exposure to this field.
I definitely resonate with that. I had no idea I was going to be interested in mental health until high school. But yeah, that's so cool. Why do you think so many teenagers struggle with sleep?
Oh, that's a great question. I well, first of all, I think a lot of it is it's not their fault. So I just want to say that to start with. I think a lot of our society, the way we structure everything, is almost at odds with getting a good night's sleep for most teens. So it's something like where 7 in 10 high schoolers get less than 8 hours of sleep, and actually the recommended. I see you nodding. You're like, sounds right. And then really the recommended hours of sleep for most teenagers, meaning people from ages 13 to 18, is 8 to 10 hours. And usually when I tell my patients that, they're just like blown away by that. Like, there's no way I need that much sleep. I'm like, you absolutely do. So I think the our society is very much focused on achievement and activity and school and 25 after school activities and school projects. And then understandably, if you're that busy, then you maybe have just a few hours at the end of it to socialize and actually feel like you're free to hang out with your friends. So I feel like it's like our days are so packed. And then you just need a few moments to, like, just be with yourself or, just like have your mind just relax. And oftentimes the tool we have is the phone, right? And so we do a lot of scrolling. So I think it's a lot of different factors that play into it. Um, and I do think there's a little bit of, and I grew up in this culture, this is changing now, but the culture of sleep is really not that necessary. Sleep is just kind of this like side thing. So I feel like there's also even a little bit of ego in it of like, oh, I don't really need that much sleep, or I did an all-nighter last night. And I say that as I said that all through high school and college myself. So I think, luckily, I think young people are more aware of the importance of sleep, which is nice. I just think society hasn't caught up to actually support the ability to get enough sleep. So I know that was a very long answer, but I think it's just a lot of different things. You have to get up super early in the morning, go to school. You're in school all day. You have after school activities. You have homework. You have jobs. It's really tough.
I definitely agree. And I think especially in the Bay Area specifically, students face so much academic pressure to do everything that like there's almost just no time for sleep. That's like a backup activity if you have enough time. Um,
Exactly.
Research says that teenagers naturally sleep and wake later. Do you agree? And why does this happen? And also kind of like how does this affect teenager lifestyles?
Yeah, so I love it because it's not even an opinion, it is science. So we know that once young people hit kind of puberty, something will happen where the circadian rhythm almost kind of shifts to later. It's to simplify. We have something called our circadian rhythm, and for teens, it's always a little bit longer than 24 hours. Which means if you were totally free flowing and had no guardrails, you could actually find yourself always moving later and later and later and later. So most teens, kind of around the time like 13, 14, feel like this. I'm not even getting signals to be sleepy until much later than my parents want me to go to bed. And then I'm not even getting signals to wake up until much later. And so this is backed by science. Of course, I'm sure there's some people out there who are like, I love the mornings. They do exist. There's some people, teens who are morning people, but the vast majority do have this delayed sleep phase or desire to wake up later and go to bed later. Now, in of itself, one could say, well, if it's a natural thing, it should be not a problem. The problem is school and your schedules, right? So those don't shift necessarily to accommodate this later time. So what we have a lot of teens doing is that they are staying up later because they're not getting the signal that's when they might actually feel more creative, alive, awake. They actually feel good in the late evenings. But then they have to wake up at like 7 or 6:30 in the morning for school. So then what we have is a lot of teens who are just basically compressing their sleep time and they're just not getting enough sleep during the week. And they're kind of sleep depriving themselves during the week. And then the weekend, I'm sure this may sound familiar, then there's a lot of catch up. You sleep in, right? They say, oh, I sleep in until like 11, noon, 1, 2 p.m., right? And then what the hard thing is you do need to catch up on sleep, right? Because you're so sleep deprived. The problem is it then perpetuates that cycle because then on Saturday and Sunday, if you're sleeping in and you don't get up until 2 p.m., how on earth are you going to fall asleep at 10 p.m.? You're like, I'm not, I just started my day. So it kind of perpetuates it. You go to bed late and then you start the sleep deprivation all over again. So I think the problem is there's the biology of it. And then I think our social structure and schedules aren't meant to accommodate that change in biology.
When kids sleep in over the weekend, does that work to counteract the sleep deprivation they build up over the weekdays, or is that like kind of a myth?
The only thing that replaces sleep is sleep. So getting sleep helps sleep, right? So I mean that in of itself. So if you are sleep deprived, sleep is the only way to do it. The problem is kind of like what I was alluding to earlier, which is though, if you sleep in and you sleep late and you wake up at 2 in the afternoon, you're going to not fall asleep again until like 2, 3 in the morning. But then school still, then you start again on Monday morning. You got to get up at 6:30 or 7. So
Hmm.
then yes, you're catching up on sleep a little bit, but then it kind of perpetuates this going to bed later and just keeps you in this cycle. So that's the problem of it. So sleep in of itself is good. Um, but it's the changing of the schedule that's really hard. So, I mean, people are like, well, then what do I do? So, ideally, ideally, trying to be that you're not up so late, right? That you have some guardrails around like not going to bed late. I know again, there's various reasons why kids are going to bed at like 2 a.m., 3 a.m. I totally know that. But the ideal would be not going to bed that late. And then on the weekends, like if you feel like I'm really tired, still getting up in the morning and
Hmm.
then maybe if you need to take a nap in the afternoon, a short nap, ideally before like 4 p.m., so to speak. The goal is to really keep you sleeping at nighttime in anticipation for the fact that you have to get up in the morning. So that's one way around it. It's, of course, people can say, well, I don't always feel exactly refreshed if I do a nap or short nap,
Hmm.
which I totally hear. But this is kind of thinking like, well, how do we make up for it, at least get a sleep snack so then you don't have too much sleep that you're unable to fall asleep at night when you need to.
Hmm. That makes sense. Um, what warning signs suggest a sleeping disorder rather than just bad habits?
And great question. Okay, so sleep disorders can come in a variety different of ways. So I think one, if you are overly sleepy despite getting, generally the right amount of sleep, and I say quote right amount with quotation marks. So if you're getting anywhere between 8 to 10 hours of sleep a night, and but you feel like you're still very, very sleepy during the day, that you need to take naps, that could be a sign that something's going on, that either your sleep quality is not quite good enough. Another type of sleep disorder is if you find that you're sleeping 12, 14, 16 hours every day, that you're just kind of just needing to sleep all the time. That could be a sign that your sleep quality isn't good. If you wake up a lot in the middle of the night, that could be a sign of a sleep disorder. Now, keep in mind, a lot of things can wake you up. It could be pain, it could be stress. I know mental health is something that you really focus on. Anxiety and depression can definitely manifest as having fractured sleep. But that's a sign, right? If you keep waking up a lot in the middle of the night, we're all supposed to wake up a couple times, but then we should easily fall back asleep. But if you find you're waking up a lot, that's another sign. And I know I'm going a lot, but I just want to show there's like really a vast majority of different ways. Another thing I want to say is like if you have trouble falling asleep when you want to, that could also be a sign of a sleep disorder. Granted, it also could be a lot of caffeine, so you need to actually, take into effect what you're doing, but not being able to fall asleep, having insomnia can be a sign of sleep disorder.
Hmm.
And then other things that I think that a lot of people kind of know about, if you're snoring, if you're gasping when you wake up, that could be a sign of a breathing issue while you're sleeping called sleep apnea. That's something that's worth looking into. A lot of people think, oh, kids don't have sleep apnea or young people don't have sleep apnea. Not true. You can still have it. So that's something to think about. If you wake up with a headache in the morning, that could be a sign that you're not breathing well either. The very final thing I'll talk about, granted, I could talk about this forever, is if you find yourself trying to fall asleep, but your body feels super restless, or your legs specifically feel restless, that could be a sign of something called restless leg syndrome. It
Oh,
seems a little bit like, wait, why is that sleep related? It's sleep related because it prevents you from falling asleep. So sometimes when people have insomnia or a hard time falling asleep, they're not really sure what's causing it. But then, when I ask, they say, well, I try to sleep, but I have to kick my legs or I have to rub my legs all night, or I keep having to like walk around. That could be a sign of restless leg syndrome.
oh wow. And then would restless leg syndrome also show up during the day?
It can. It doesn't for everybody. So some people, it only shows up in the evening when they're trying to settle down. So some people feel great during the day.
Mhm.
And then when they're actually finally trying to settle down, that's when they start to feel restless. Some people have it where they have it during the day and night, but sometimes it's fine during the day.
Oh wow, that's very interesting. And another one more related to, I guess, the mental health aspect of things. How do you think sleep affects teen mental health? I know you mentioned briefly how like depression and anxiety can cause kids to wake up a few times during the night, but are there other like ways that sleep is correlated to mental health?
Oh yeah, no, what a great question. So sleep is very much hand in hand correlated with mental health. Unfortunately, it's a little bit of a bi-directional relationship. So I mentioned how having depression or anxiety can affect your ability to stay asleep.
Hmm.
Depression and anxiety can also affect your ability to fall asleep. It can actually also cause insomnia. There's some people who that manifests that way. There's some people who actually their depression and anxiety makes them sleep more, right? It's almost like a coping. Like it's like I just, the world is let me just kind of hide from what's going on. It's a coping mechanism. I'm not saying it's good or bad. It's just like what people sometimes still do as well. So sometimes it's insomnia or hypersomnia, which means like oversleepiness.
Hmm.
Um, that's like one way it can go in one direction. The other direction is that if you don't sleep well, it can make your depression and anxiety symptoms more pronounced or worse as well. So unfortunately, it's some of the patients I see can get into this spiral where they their anxiety or depression doesn't let them sleep well. And then because they don't sleep well, their anxiety depression's worse. So then they don't sleep well. And so their anxiety depression's worse. And then they don't sleep. So they kind of get into this little bit of a spiral. So usually when that happens, I say, okay, well, we kind of have to address both in parallel. So we need to figure out what can we do from habits, screening, looking for sleep disorders, and really focusing on your mental health as well. Sometimes I have patients say, look, we'll just fix the sleep and everything will be better. And I say, well, it's not quite how it works. It's a little bit of working on both at the same time, I think is usually the best way.
Hmm.
And it can be, and I will say it can be pretty serious. So sometimes it can just be, oh, I'm sleepy. I just don't feel, I'm a little bit down. It can actually be pretty serious for some kids. So it could make depression, pretty severe if you don't sleep well.
Oh, wow. I had no idea that a correlation was that strong. What are realistic, easy ways that busy students can help improve their sleep or get more of it? I think you kind of touched on this earlier with like maybe taking naps before 4 p.m. But yeah, I do know that a lot of kids, especially in the Bay Area, but like all over the place, there's just too many things going on for them to get the right amount of sleep in the night.
Yeah, I mean, I really hear that, and I think it's a little bit tricky. So I'll answer the easier part first. So naps and brief naps can be really helpful tools. So when I say brief naps, I mean like 20 to 30 minutes.
Oh,
And I know that people are like, that's not enough. The
yeah.
way I think about it though is almost think about like if you have think of whoever in your family is the best cook in your family
Hmm.
and they're making this amazing dinner, right? And they're like, all right, guys, come hungry. I'm making this great dinner. But you
Hmm.
find that you're hungry, say like 11 a.m., right? But you want to save space. You're not going to load up on some random junk food or something that you see, or potato chips, right? In your pantry, right? You're going to be like, well, let me just have a little bit so I get rid of the hunger, but then I can really get like enjoy the full meal dinner later, right? So that's the way you should think of sleep is, I'm sleepy now. I want to still sleep at night when I should. So let me get a little bit of a snack just to take the edge off, right? And that's what the 20 to 30-minute nap will do. And then you can still sleep at night. So the nap is not supposed to be completely restorative, but it's supposed to help kind of, like I said, make it a little bit easier. The reason why the short nap is because, and many people have probably done this, where you take a long nap and you wake up feeling more sleepy from your
Yeah.
nap. Right. So you're trying to avoid having that sleep inertia. So that's what short naps will do. So that's one thing. And trying to do it again before 4 p.m. is to give yourself enough time that you can rebuild up your sleep need or your sleep drive.
Mhm.
It's called your homeostatic drive or your sleep drive in time that maybe you fall asleep by maybe 11 p.m.
Mhm.
Or whatever time that you need. Now, the other thing to do, you alluded to something very important, that part of the problem is that there's so much to do. And it's kind of where I even started this discussion of like, society is very much like do, you need to achieve, you need to do all these things because you need to get these like degrees and these accolades and all this stuff. And all those, it's important, I will admit. Like I was also, when I was a teenager, I was also someone who was really driven to try to achieve and accomplish, and I really respect that. And I know you have a lot of people probably listening who themselves are really take pride in accomplishing, and so I really want to honor that.
Yeah.
However, I will say sometimes you have to kind of make some choices. And this is also what happens like as you get to be an adult. You realize after a while, like there's only so many hours in the day. And if I use my brain, and I want to use my brain for thinking, working, doing, I want to achieve the best, I actually have to rest it. And this is a realization I think that unfortunately a lot of adults learn later the hard way. So I think if you can, if teenagers or young people can learn that early,
Mhm.
that actually gives them an edge. So if you think of high achieving athletes, right?
Mhm.
Olympians, professional athletes, all of them really take rest is a huge part of their training, right? So none of them go like, well, I have to get to the Olympics and I can't rest. I'm too busy, right? No, they say, okay, part of what I need to do is work really hard and make sure I get rest. So
Mhm.
I say that it's more of like almost like a mindset or paradigm shift,
Mhm.
knowing how hard that is. So I think I always tell people like, well, maybe do an audit of all the things that you have in your life and that you're doing.
Mhm.
And you should have work, achievement, a little bit of play, right? You need to have some
Yeah.
play and non-scheduled time. And think of like, okay, out of all the things I'm doing, what maybe is like the least important? What could I cut out,
Mhm.
or reduce? And so that's that. And that's hard advice, I know, but I really do think there's no way we can make more hours in the day. So we really just got to figure out how we're using them.
That makes sense. Definitely easier to say than do. Um,
Absolutely.
that was actually our last question that I had for you today. So, thank you so much for your time today. I learned a lot, and I think our viewers will learn a lot too. And yeah, thank you so much.
Great. No, thank you so, again for having me. And yeah, this was fun. Happy to come back if more questions come up.
Okay, I will definitely reach out to you if any more questions come up. Thank you so much. Bye.
Bye.